Hello, everyone. My name is Dr. Lola Asay, and today I'm going to be talking about blood pressure. So I had a patient whose blood pressure was over 150 over 100, and their normal blood pressure is 120 over 80, right? And or less. Well, she'd been told her blood pressure was high. She'd been given medication already, but she didn't really like the way the medication made her feel. She just really also didn't want to take medicine. So she just stopped taking them and she would just, take them sometimes. But she also didn't follow up with her doctor. The thing about this is this happens a lot. It's very common. A patient has heard someone hears they have high blood pressure, they're started on blood pressure medication. Maybe they take it for some time and they feel fine because sometimes high blood pressure doesn't cause any symptoms. And so they may just forget about it or, until they come in to see their doctor for another reason. And then again, they're told that the blood pressure is high. So if you or someone you know are in this category, this episode is for you. You're listening to Connecting the Dots with Dr. Ashaye. I'm Lola Asay. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in Sugar Land. And we're an innovative medical clinic, and we offer an alternative way to receive healthcare that is stress-free and focused on the patients. So I've been practicing medicine now for over 15 years, and high blood pressure is one of the most common conditions I treat. And I've seen people at different stages of the diagnosis. I've seen how it affects their health at different stages. And some people start off with, maybe a little bit of high blood pressure and, they feel fine, so they ignore it. But then over time, a lot of times it starts to put a strain on their heart, on their kidneys, on their organs. And some have very high blood pressures, and some of them even have symptoms. And a lot of times, those people will try to address it somewhat because of the symptoms. But sometimes you see people not realizing that the symptoms they have, like they're dizzy all the time, or they have headaches sometimes, or they have some chest pain sometimes. They don't realize that it's coming from their blood pressure being too high. And so they come in for those things, and then we find out that it's their blood pressure. But regardless, when blood pressure is addressed, most people start to feel better. And also importantly, they avoid the negative consequences of high blood pressure, which is really the whole point. So I'm going to give 3 tips about blood pressure, high blood pressure. So if you have high blood pressure, my first tip is don't ignore it. Try to make sure you check it regularly. Some people need to check it more than others. Most people can check it 2 times per day for 2 weeks every month. So you can check it morning and night for 2 weeks out of the month, and then have your log, ready so that when you see your doctor can look at the values. So the values that you get at home are actually very important because your natural environment, it tells us much more about what your blood pressure is doing when you're in your natural environment versus when you get it checked at a dentist office or a doctor's office if you're nervous or anywhere else. So your home values are actually very, very helpful. Ideally, you want to talk to a doctor that will emphasize lifestyle changes, not just medications. So let's go back to my patient. So she's taking her medications. She's now taking them as needed. So sometimes she'll check it. If it's high, she'll take it. If it's not high, she won't take her blood pressure medication. So I see that commonly as well. And the problem with that is not how most blood pressure medications work. Many of them actually need to stay in your system for a period of time to be effective. So my second tip is if you are taking blood pressure medication, except your doctor has specifically told you to take it as needed, don't take it as needed. Don't skip doses because you're causing your blood pressure to fluctuate, which is not good either. So, for example, if your blood pressure medication is supposed to be taken once a day, a lot of times that's because it's only in your system for 24 hours. So if you take it on Monday and then wait till Wednesday to take it again, then your blood pressure may be high on Tuesday. And maybe it won't be high Tuesday morning, but if you don't check it Tuesday evening, it may be high then. And maybe you don't have symptoms, so you think it's fine. So except you've been specifically told to skip doses or take it a certain way that is different, don't do that. It's very important to try to take it about the same time every day. Okay, so before I share the third tip, if you want to help spread the word and share valuable resources with others, there are 3 easy ways you can do that. You can subscribe, you can share, and you can like. By doing these 3 things, you help others improve their health and you help us reach a wider audience. So please let people know to check us out. So take a moment now, if you haven't already, please go ahead and subscribe to our channel, share this video, and like our other videos as well. It's a small action. It can make a big difference for some people that have high blood pressure or other conditions that we've discussed on this channel. So let's work together to reach more people. Thank you. Okay, so what if, like going back to my patient, what if like my patient, you or someone has side effects from their medication? So that's also very common where, a patient is given a medication and they have some negative effect from it. Maybe it's nausea, maybe it's headaches, maybe it could be anything. Well, that's where my third recommendation comes in. Try to follow up with a doctor that actually listens to your concerns and is willing to help you figure out things, okay? Because you don't want to be given a medication and then wait another 6 months or a year before you follow up, especially if you're not taking the medication because you have side effects. So having a doctor that you can follow up with easily, a doctor that will listen to you, is very important because that's the whole point of trying to take care of your health, is that you're able to reach your doctor when it matters. So in that scenario, you may need to do a different class of medications. You may need to take it differently. Maybe if you're on more than one medication, you may need to take one in the morning, one at a different time of the day at night or bedtime or afternoon. You may need to work harder on lifestyle changes. Maybe medications are not agreeing well with you. Then you may need to be more proactive about, reducing the sodium in your diet, walking more frequently, exercising, doing things that will lower your blood pressure more naturally. And it may take some time though, so that's why it's good to work with someone closely that can help you through it. But most of the time, we can achieve a normal blood pressure if you stick through it. But don't ignore your blood pressure. Remember that, it may take some time. Some people even do well with supplements, for instance, but just be patient with the process. And oftentimes, getting the blood pressure normal will make you feel better and also make you healthier in the long run. So remember that the goal is good health. So some people are going to achieve that differently. Some people would need to take medication to get their blood pressure lower. Some people don't, but at the end of the day, the most important thing is that we're not focused on whether or not we're taking medication. We're focused on whether or not we're healthy, because that's really what the point is, to achieve better health. So here are the 3 tips. If you've been told you have high blood pressure, number 1, don't ignore it. Check it regularly as directed by your doctor. Number 2, if you're taking medication, don't skip doses. Try to take your medication exactly as directed by your doctor. And number 3, if you have side effects from your blood pressure medication, and if your blood pressure medication is not controlled, follow up with your doctor. Follow up with the one that listens to your concern and that can help you lower your blood pressure. So remember that high blood pressure can lead to heart conditions, it can lead to strokes, kidney damage, it can affect the eyes, and many other organs over time. So it is definitely worth stopping to take care of it and to address the blood pressure before things get much more complicated. All right, so that's what we have today. If you're in the Houston area, if you have high blood pressure or other conditions and you're looking for a doctor who's proactive about your health, we're here for you at InTouch Primary Care. You can learn more about our services and how we can help you by visiting our website, intouchprimarycare.com, or you can call us at 713-280-9985. We look forward to helping you on your journey to better health. So imagine you start paying attention to your blood pressure and it's controlled. Just remember, you're actually preserving your organs. You're reducing your risk for heart brain, kidney damage, eye damage, and many other conditions. And in addition, because you're working on lifestyle changes, you feel better, you have more energy, and you can look forward to a good quality of life to enjoy with your loved ones. So address your blood pressure. Don't delay your care. I hope that helps.